Hello, everyone. Thank you for joining us. My name is Joshua Kroll, and I am the Director of Sales and Marketing with Evexia Diagnostics. We are pleased that you are with us for this month's webinar on identifying laboratory biomarkers of cardiac health. Before we begin, I'd like to introduce our presenter, Dr. Wayne Sedano. Dr. Sedano is the Director of Clinical Support and Education for Evexia Diagnostics and frequently lectures worldwide on various topics of integrative and functional medicine. He is the author of the book Integrative Medicine Approach to Thyroid Disorders and is about to release his next book, Integrative and Functional Medicine Approach to Basic and Advanced Laboratory Interpretation. Dr. Sedano provides one-on-one clinical support to clients of Evexia Diagnostics through our Ask the Doctor platform and can also be available for telephone and video consultations as well. Please note that we will address any questions at the end of the webinar. Now, without further ado, I will turn the webinar over to Dr. Wayne Sedano for his presentation on identifying laboratory biomarkers of cardiac health. Dr. S.
Thank you, and welcome everyone to this webinar. It's an exciting webinar, and I'm proud to go ahead and let you know all the good stuff that's happening in the world of biomarkers for cardiac health. So let's go ahead and get started. First of all, you may be aware that identifying the risk factors for cardiovascular health, what is that going to enable you to do? And like it says on the slide, it's going to enable you to personalize your therapy when you're looking at dyslipidemia and you're looking for cardiovascular conditions and you're assessing the patient's risk and you want to maximize treatment. So that's what this webinar is really about tonight. So I want to review the major coronary artery risk disease factors, and this is also the same as the cardiovascular disease factors. A lot of these you certainly may be familiar with as we look over onto the left part of the slide, the major factors, certainly advanced age, looking at high total serum cholesterol, looking at if there is high non-HDL cholesterol, which I'll be reviewing, and if there's a low amount of the good cholesterol, HDL cholesterol, diabetes, hypertension, smoking, and of course a family history of coronary artery disease. Other risk factors that I'm sure you're aware of: obesity, and certainly central obesity, also known as abdominal obesity. If there's a family history of hyperlipidemia, small, dense, low density lipoproteins. I'm going to be reviewing those because we're going to be looking at a test known as the NMR lipoprofile. So just be patient for that, please. Next, I'll be talking about apolipoprotein B. If there's an increase, you're going to understand what those are as soon as we get in about halfway through in this seminar. Next, looking at increased low density lipoprotein particles. Certainly all these are going to cause increased risk of cardiovascular disease and certainly major coronary artery disease, polycystic ovarian syndrome, dyslipidemia, triad. Other factors and other risk factors we're going to be looking at is the elevated lipoprotein A, if there's elevated clotting factors, in particular fibrinogen, which is also known as clotting factor 1. We're going to be looking at inflammatory markers as it relates to cardiovascular disease, high sensitivity C-reactive protein. Next to that is a lipoprotein-associated phospholipase A2, hyperhomocystinemia, and elevated uric acid. So we got a lot to cover tonight, so hang in there, and I'm sure you're going to be pleasantly surprised as we work through this webinar tonight. Now, first thing I want to talk about kind of out of the gate is this thing called this atherogenic dyslipidemia triad. So triad meaning three things kind of occurring at the same time. First, an increased blood concentration of what's known as small, dense, low-density lipoprotein particles. And if you're not familiar with those, you will be by the end of this seminar, because those are the ones that are oxidizable and can cause plaquing and damage to the blood vessel walls. The second one here is decreased high-density lipoprotein particles. Now, you may be familiar with those, the HDL particles. Those are the ones that can remove cholesterol from the tissues and bring it back to the liver for recycling of cholesterol. Next is increased triglycerides. All of those three put together are known as the dyslipidemic triad. And as it reads on the bottom, a typical feature of obesity, metabolic syndrome, insulin resistance, type 2 diabetes, and this whole atherogenic dyslipidemia that has emerged as an important risk factor for myocardial infarction and cardiovascular disease, as you can see on the slide. So when you get your lab tests back and you do just a basic lipid panel, and if you see that there is an increase in total cholesterol and also an increase in low density lipoprotein cholesterol, these are some of the things that you may want to consider. Certainly hypothyroidism. There could be a problem with the kidney, known as nephrosis. There may be systemic lupus erythematosus. That's an autoimmune disease. Next, if the patient is taking progestins and anabolic steroids, if there's a problem with the liver, and with some treatment, if the patient is being treated for HIV with protease inhibitors, that is going to create an increase in total cholesterol as well as an increase in low density lipoproteins. I just want you to be aware of these secondary conditions that are involved with dyslipidemia. And here's another set of secondary conditions. If you get back high total triglycerides and high, very low density lipoproteins, that's the VLDL cholesterol, there's going to be some crossover. Certainly hypothyroidism is going to create that same pattern that you saw on the previous slide, and that's due to the metabolism being low on the individual with hypothyroidism. But other things to consider, again, if there's renal problems, type 2 diabetes, obesity will present this way, excessive alcohol intake. But look at the list of medications, antihypertensive medications, thiazide diuretics, beta adrenergic blocking agents, corticosteroid therapy, estrogens, if they're orally administered estrogens, oral contraceptives, all of those can cause an increase in triglycerides and very low density lipoprotein increase. So I want you to be aware of those as we go through looking at these secondary conditions. Now, back to the basics here. I know there's been a lot over the many years about cholesterol's a problem and cholesterol's what the problem is. Well, it really is not. But the controversy that started with cholesterol is that the sheer fact that the plaquing is loaded with cholesterol. So it's not so much the cholesterol in the diet. There could be part of that as well, but it's what happens to the cholesterol, and that's where we look at these subfractions, particularly the small, dense, low-density lipoproteins that are oxidizable that will bring the cholesterol into the arteries and it begin the plaquing. So that's really what's important. As you see on the slide, it's the subfractions of the lipoproteins that we're going to be reviewing tonight. So you really got a good handle on this. Now, just to be clear about cholesterol, we need cholesterol. We have to supply it in the diet, although we do make some. But think about all the areas of the body where cholesterol is needed. Certainly, it's a part of the cell membrane, and it's precursor to steroids. And I have listed here what cholesterol is a precursor to. It's a precursor to cortisol, precursor to vitamin D, precursor to bile acids. It's also a precursor to reproductive hormones, progesterone, the estrogens, and also androgens. So if we're trying to lower cholesterol very, very low, think of the compromise in the cell membrane, because cholesterol is part of that cell membrane, and the precursors to these hormones that I have listed on the slide. So it's about balance. I certainly wouldn't want to see a cholesterol level around 100 milligrams per deciliter back on a lab test, because the adrenals are going to be compromised, reproductive hormones are going to be compromised. So this is really about balance. We definitely need the body to produce, cholesterol and a little bit in the diet as well. Now, the thing about looking at low density lipoprotein cholesterol levels, here's the real take home message, mainly for tonight as we proceed through. Just looking at the cholesterol content of the low density lipoproteins, it can vary from person to person. Right. This is where these advanced tests are extremely helpful, because advanced tests are going to break down, look at these subfractions, which I'll show you. It's the subfractions, and in particular, the low density lipoproteins, the small dense particles. Those are the ones that are easily oxidizable, meaning oxidized low density lipoproteins. Those are the ones that contain less cholesterol, but at greater risk of cardiovascular disease, because those are the ones that are going to lay the plaque down. So please keep that in mind. Another value that you will be getting back on your laboratory test is this value called non-HDL, so cholesterol. And non-HDL cholesterol, is more closely related to cardiac risk factors than LDL-C. Now, the thing about this, the non-HDL cholesterol, it takes a look at all of the particles that accept the triglyceride and of course kept the HDL, and gives you a little better risk factor, like I said, than just looking at the HDL cholesterol. And you're going to see that back on your lab test when the results come back. Ordering just a basic lipid panel, there'll be a level of non-HDL cholesterol. So next is to look at the lipoproteins, the apolipoproteins in particular. So what are these apolipoproteins? So you have to go all the way back and remember in your physiology that apolipoproteins, they're a protein component of the lipoproteins. And what they do is they stabilize the lipoproteins in the blood, and they tell it where to go, what receptors, and that's going to allow the lipoproteins to be recognized by the cells and deliver fats and cholesterol where it needs to go. The thing about this one on the slide here that you see the value of the apolipoprotein B is that particular marker is on the low density lipoprotein cholesterol, the very low density lipoprotein cholesterol, intermediate density lipoprotein, and also on a lipoprotein called lipoprotein A, which are reviewing. The bottom line here is, since that particular marker is on all of those atherogenic particles, right, it is considered an aggressive marker of overall risk for atherogenic particles. And that's why you'll see on the Evexia panels that is included in some of the panels looking at apolipoprotein, particularly the one called apolipoprotein B. So please keep that in mind. Now to transition over, I want to talk about this lipoprotein that is called lipoprotein A. So what is that? That is a genetically determined lipoprotein, and it has a little bit of an interesting history to it, because in the 1960s, this genetic variant was discovered. Now it's a genetic variant of the low density lipoprotein. And how that differs from the regular low density lipoprotein is by molecular weight. Now the apolipoprotein is a circulating lipoprotein, and it is composed of what's known as apolipoprotein A. A little confusing, but just hang in there. The bottom line is that apolipoprotein A, again, genetically determined, when it's high, it tends to promote thrombosis by interfering with the fibrinolytic pathway. And that's the important take-home message here. And that's why it's looked at on a lot of tests. Again, this is genetically determined. The big deal with this is that, again, apolipoprotein A can promote thrombosis by interfering with the fibrinolytic pathway. And here's, if you want a little bit of a history on that, here's how this works. This particular variant of lipoprotein, which is called lipoprotein A, it has an apolipoprotein A that is structurally similar to what's known as plasminogen, and it can act as a decoy and similar to the cascade or the coagulation cascade and promote thrombosis. So that's the deal. So this is genetically determined. And it will be looked at on the test as well, part of the Evexia panels and other panels. Now, talking about panels, this one panel that I want to talk about here is called the NMR lipoprotein panel, which is offered by Evexia. And what that is the expanded lipoprotein panel, and that's going to measure the lipids. It's going to measure the subfractions of the low density lipoproteins, look at particle size and particle number. It's going to look at the apolipoprotein B, and it is preferred over the standard lipid profiles because they're just going to measure cholesterol, low density lipoprotein, triglycerides, and HDL. You really want to know what's going on with the particles, if they are oxidizable, the smaller ones, and I'll be reviewing that certainly on an upcoming slide. But just this is a wonderful test. Now, this NMR lipoprofile is the expanded lipid profile, and what it's going to do, it's going to give you numbers on low density lipoproteins, high density lipoproteins, their particle size and numbers, the ones that are directly related to risk factors for cardiovascular disease. This profile also gives you what's known as a lipoprotein insulin resistance index. And what they're able to do via a calculation, they look at 6 lipoprotein parameters that are associated with insulin resistance. So you're also going to get back a level of an insulin resistance index on this particular panel. So it's a really good panel, a really good profile. Some of the other markers of cardiovascular health or dysfunction here are on the slide. I'm going to be reviewing most of these tonight. You should be familiar with high sensitivity C-reactive protein, Hopefully you're familiar with lipoprotein-associated phospholipase A2, fibrinogen, homocysteine, vitamin D, some of the insulin resistance markers, insulin, heart failure and heart stress monitors. One I'm going to be going over is NT-proBNP, and then omega-3 and omega-6, and there is also some genetic testing that's important as well. Now, in regard to the panels that are set up, the Evexia has some wonderful panels. There's 3 of them, and I want to start you with the basic panel. This is the Evexia Cardiovascular Risk Panel, cardiovascular panels you see here. This would be the first line. This is the one that I would order, just checking, getting a good baseline if there is a suspicion of cardiovascular disease, and you really just want to find out, what is going on here. And you'll see the other panels have more analytes to them, but this would be what I would call the baseline or the first one. Certainly, it's going to look at the apolipoprotein assessment, CBC, comprehensive metabolic panel. It'll look at C-reactive protein, creatinine kinase, fibrinogen activity. That's factor 1. I'll be discussing that. Gamma glutamyl transferase. It's going to look at hemoglobin, the A1C, with the average glucose as well. It'll look at homocysteine, lipoprotein A, which I talked about, magnesium levels, and this one as a baseline offers that NMR lipoprotein, lipoprofile, test that I just spoke about. The next panel is the Evexia Comprehensive Cardiovascular Panel. That's a little level above there, aside from the basic. Now, why would you want to order this? If you already believe that there is some systemic inflammation going on with the individual, you want to take advantage of looking at more details and assessing more analytes. On this one, there's going to be, in particular, you'll see the analytes TMAO. I'll be going over that. That's trimethylamine and oxide. There is going to be a look at the oxidized low-density lipoproteins. Those are the ones that are going to damage the arterial walls and cause plaquing because they're oxidizable. Think of oxidative stress. This one, again, looks at the lipoprotein-associated lipophosphatase A2. You will know what that is. Hang in there. And it's going to look at the omega-3, omega-6 fatty acids, give you the insulin resistance markers, vitamin D, 25-hydroxy as well. So this one is loaded up fairly well. Now, there is another panel that's a step above that. This is the Evexia Premier Cardiovascular Panel. This one, you want to consider ordering this panel when there's definite presence of significant cardiovascular disease, heart disease, significant inflammation, and certainly significant vitamin deficiencies that are important to cardiac function. This is the one that you would want to order. This is like the, again, like it says, it is the premier panel, like it reads. It's going to give you the addition to what I just talked about, the basic panel and the comprehensive panel. It'll look at coenzyme Q10. It's going to look at folate. It's going to look at what's known as glyce A. I'll be reviewing that. Getting into the TMAO, it'll look at matrix metalloprotein 9, myeloperoxidase, pardon me. And so it's really comprehensive. Again, I'll be explaining these. Just to step back just for a moment, remember that I do want to talk about the high density lipoproteins and the subfractions, which that particular, the NMR lipo panel is going to look at. The large high density lipoprotein subparticles, they are related to cardioprotective. So that's good to know because you're going to get that information back on the panel that's going to look at these subparticles. But I want to give you a warning in my clinical experience. If high density lipoprotein is high, which you want, but you don't want it too high. If it gets really high, say around 100, you need to question that because the high density lipoprotein can actually change its composition. And I have seen this run high in autoimmune disease when it starts pushing over 100. So it's too much of a good thing. So that's a little clinical pearl for tonight I want you to be aware of. Now, looking at these smaller particles of the LDL particles, like I mentioned, those are the ones that are oxidizable, and you're going to hear it for the second time here. Those are the ones that are highly atherogenic. You're going to get a number on those. That's the important and the power of these expanded lipoprotein profiles for you to take a look at. You're just not going to have, well, this is the low density lipoprotein number. You're going to be able to look at are these small dense particles that are oxidizable, and how many are there? That's what this test shows, because it's going to give you the particle size. It's going to say, okay, how many of these small dense lipoprotein particles, which are highly atherogenic, how many do you have? and what is the number of those. So that's the power of these more advanced tests. Now, high sensitivity C-reactive protein, you certainly should be familiar with. That is an independent marker of inflammation. And a C-reactive protein is an acute phase protein. What happens in the body as the body produces what's known as interleukin-6, it'll go to the liver, and the liver will go ahead and start manufacturing this C-reactive protein. Now, I often ask at a lot of seminars that I deliver is, what the C-reactive protein, does it have a job because the body produces it? And if you're not familiar with that, it certainly does. It helps the immune system. It paints targets on dead tissue or things that don't belong there for the immune system. So when you see C-reactive protein going up, it has a job other than just saying, okay, it's a marker of inflammation. So I want you to be aware of that. And certainly high levels reflect activity of inflammatory cytokines like interleukin-6, and they are linked to increased coagulation and also endothelial damage, damaging the lining of the arterial walls. This other marker, and speaking of the arterial walls, guess what? This marker, this lipoprotein-associated phospholipase A2, that is an enzyme produced by the intima and at the base of the atherosclerotic plaque. In other words, it's produced right at the plaque. So that enzyme, when that goes up, it is a specific marker for vascular inflammation. That's why it's important to take a look at that marker, particularly if the individual has known or suspected cardiovascular disease, even hypertension. So that's a really, really good marker. Again, that's an enzyme marker. And when that thing runs high, you know we're talking about the media intima, if you remember that from the artery, because that's where that is produced. Homocysteine, another marker. You're probably familiar with the homocysteine goes up. It certainly could be a nutritional marker needing B12, B6, and folic acid. The thing about this particular marker, when it goes up, it can promote thrombosis and cardiovascular disease. It does that by the bullets you see on the bottom. It'll increase the expression of adhesion molecules, cytokines, tissue factors. It also will increase blood coagulation factor 5. It'll inhibit fibrinolysis. In other words, it won't let the fibrin break down properly, again, clogging up the arteries. It's going to disrupt the nitric oxide metabolism. Remember, nitric oxide is a vasodilator. And it also can increase platelet activity. That's why you want to make sure homocysteine is down and within an optimal range pretty much at all times. Next, fibrinogen. That is also known as factor 1. If you're looking at the cascade, the coagulation cascade, that's the one that just starts the whole ball rolling if you get a cut and you need to clog that up. But you don't want this to be overactive, because the fibrinogen, that is the principal clotting protein, but it is has a key role in the occlusion, arterial occlusion, by promoting thrombus formation. It can injure the endothelial tissue, and also this thing called hyperviscosity, make the blood thick. And if the blood is thick, it's going to cause damage as it goes around the arteries and cause endothelial damage. So that's the indicator for fibrinogen. Keep in mind that this fibrinogen as an analyte will go up with tissue inflammation, also tissue destruction, and it is also increased at the plaque area. So it's important to take a look at that. That's why these advanced tests and the Evexia panels include that. Very important risk factor. Next, vitamin D. Now, the one I have on the slide here, the 125-dihydroxyvitamin D, that is the active form of vitamin D. That's the one that binds to the receptors. That's the one that promotes cellular proliferation, differentiation, apoptosis, takes care of some oxidative stress, is involved in membrane transport, as well as certainly the absorption of calcium, as you probably know. But this is the active form. This is the one that goes to the DNA. Now, vitamin D, the thing that you may not know about vitamin D, the vitamin D receptors have been found in all major cardiovascular cells, including the cardiomyocytes. It's found in the arterial wall and also the immune system. So that's the connection why you want to take a look at vitamin D levels, especially 25-hydroxy vitamin D, because vitamin D studies have generally demonstrated it as an independent association between vitamin D and degenerative cardiovascular disease. That's why that's on the panel as well. So it's important to know that. This other analyte may be new to a lot of you, hasn't been around all that long, TMAO, that's trimethylamine N oxide. So what is that? So that is a dietary metabolite. It is produced by a pathway involving gut microbiota. Surprise, surprise. Right. Here's the deal with that. And by the way, if this runs up, you may want to do a stool analysis and clean up the gut as well and do some dietary changes as well. Because here's what happens when this analyte goes up. What it will do is it'll promote atherogenesis by what they call upregulating the tissue macrophages. And what's going to happen is that's going to reduce the reverse cholesterol transport. In other words, cholesterol will go to the tissue for wherever it's needed, but cholesterol will get pulled back out of the tissue and go to the liver. This thing prevents that. So this is a kind of a dual analyte, looking at the gut microbiota if it goes up, also looking at the diet, but it is a potential risk factor for promoting atherosclerosis through that upregulation of the macrophages. And like it reads there, it reduces the reverse cholesterol transport. In other words, cholesterol deposition will continue to increase in the tissue. This is a calculated marker you see here. This is, you may have heard of glycosylation, and hemoglobin A1C is an glycosylated hemoglobin A1C. That's what that is. And this marker, it is found and derived from that NMR signaling. And what they were able to do when it goes through the analysis and goes through the machine, it is a marker of systemic inflammation. Now, the unique thing about this marker is that it tends to be more stable for systemic inflammation than even high sensitivity C-reactive protein. That's why it's used. And it's going to give you an idea of what is going on with systemic inflammation, because it doesn't vary a whole lot up and down. It's a fairly stable marker. Again, the marker, it is qualified by the NMR signal. So when you order the NMR lipo profile, this is part of that as well. It's a great marker. Another marker that may be new to a lot of you is this matrix metallopeptidase 9 marker. That's another marker of inflammation. It's a marker of tissue remodeling, wound healing, and mobilizing of tissue-bound growth factors, right? And it is expressed with abnormal collagen deposition, and it's been related to pancreatic cancer, lymph node metastatic cancer as well. But it's also been related to numerous other clinical conditions, rheumatoid arthritis, and in particular, coronary artery disease. It is a good marker for that. Just think of another inflammatory marker that is a good thing to take a look at as it relates to coronary artery disease, but other diseases as well. And finally, myeloperoxidase. Now, this particular enzyme is going to play a role in the innate host defense mechanism. If this is a yin and yang thing going on here. The myeloperoxidase will go up because it is a strong reactive antioxidant, so it has potential antimicrobial activities. Think of hydrogen peroxide, which is produced by the macrophages. Again, strong antioxidant activity, antimicrobial activity, but it could be too much of a good thing, letting you know that with too much antioxidants, or if the body has a need to keep producing antimicrobial activity or keep producing this particular enzyme, you may want to again look at is there a chronic infection going on with the individual. The bottom line here, this is a good marker for looking at reactive oxidants. And if it runs high, it's also going to promote tissue damage, because anything that is a strong antioxidant certainly is going to be an antimicrobial, but it's also going to cause damage to the tissue and systemic inflammation. So that's another marker of that as well. A marker that's also on the panels is this NT-proBNP. That's N-terminal pro BNP. That's B-type natriuretic peptide. That is a peptide that is released right by the ventricles. If there's a lot of pressure in the ventricles going on, or overload, this particular marker is going to be increased on that. Normally, there's very low levels of BNP in individuals, but as there's more pressure on the myocardial walls goes up, or if there's overload, this analyte is going to go up, and it's going to give you a window into what is going on with the heart here. There's more pressure. It's kind of like, you know, a pressure gauge for your tire for your car, saying, you know what, we got too much pressure in here. That's really how I would look at that. So it's a wonderful marker that you can use from a biomarker standpoint of view. So next is to take a look at what's known as the functional health report. If you're not familiar with that, Evexia offers a functional health report. It will look at your laboratory tests that you order, certain ones, there's certain analytes that you need, and they have a computer that can run through and give you an idea of what's going on with the blood. In other words, you look at the table of contents here. It'll help you with answer some questions on what can you do to improve the health of the patient. What particular products may be recommended based on deviation of certain analytes. It'll let you look at the blood test results and do a comparison from a functional medicine perspective. It'll give you the percentage of deviation out of the optimal range. It'll give you a functional index, which I'll show you on the next slide or two. It'll give you a nutritional index. In other words, what areas of nutritional deficiencies require the most attention and potentially why, and then it'll give you an idea of some clinical dysfunctions based on the blood chemistry. So here is a look at the sample report that you'll get back. This is after the computer does its analysis. This is the blood report. This is just a part of that, as you can see here, just looking at glucose, hemoglobin A1C, blood urea nitrogen, creatinine, and so forth. It will look at certainly the optimal ranges, give you an assessment, look at the standard range. Here are the units of measure, and this is color-coded. If yellow is above the optimal range or below by the arrows, and if it's above the standard range, it's going to be in the red area, and then what it looks like to me is this purple area when things are in the alarm range. It's going to let you do a comparison. You can also see the previous test, see if the patient is improving, also by the thumbs up and thumb down. So this gives you a really good look at, integrates the blood test as a computer analysis of that as well. Now, the functional index report, now that's going to look at the laboratory tests, and it's going to give you an idea of the most likely dysfunctions. And as you see the scoring right here, 90 to 100% dysfunction, highly likely. In this case, something's going on with the lipids, and also there was a 91% chance, which is high, a likely dysfunction of cardiovascular. It's going to draw your attention to that. So it's a really great analysis to make sure that you're covering your bases here and you're looking for these particular problems that the computer analysis picked up. It's also going to give you a list of some recommended nutraceuticals that can help, and recommended nutraceuticals for consideration. Here, hyperlipidemia, there is a nutraceutical called Phytosteroid Plus. There was an increased risk of cardiovascular disease. You may want to consider coenzyme Q10. Endothelial damage, like I talked about, there's a product called Vessel Plus, things for you to take a look at. So it'll give you a readout on that, and certainly, more of a readout and more supplements as well. Now, what you'll also get back on the report is to help you and your patient, because there's also a readout. In this case, a readout, hyperlipidemia was picked up. So it explains what that is, the increased risk, the potential for atherosclerotic coronary artery disease and so forth. And it tells you how it was worked out by the computer. So look, total cholesterol was high, triglycerides were high, low density lipoproteins were high. All that put together said, this is hyperlipidemia. And then it discusses which supplement is helpful and then why. And this one in particular is a Phytosterol Plus that has a statin-like substance in it that can help lower cholesterol while you're working on diet and things of that nature. So here is another one for you to take a look at. This is increased cardiovascular risk, and this is how it was analyzed, the rationale from the computer. It was high total cholesterol, high triglycerides, high low density lipoprotein, fibrinogen was up, C-reactive protein was up, and vitamin D was low. And it lets you know, what is going on with this. This was the rationale why increased cardiovascular disease was picked up. So the computer does a good job helping out. In this case, it recommended some coenzyme Q10. And finally, we got the endothelial dysfunction was picked up based on the increase in fibrinogen and increase in high sensitivity C-reactive protein. It explains how that was picked up and a particular product, nutraceutical, that may be very, very helpful. So I'm going to go ahead and turn this over to Mr. Kroll.
Thank you so much, Dr. Sedano, for that excellent insight that you just provided. I'll take a moment now just to address any questions that may have come up during your presentation. If you would like to either type your question into the chat window, or you can use the raise your hand option, and I'll be happy to unmute you. Or of course, if you would prefer, you can always send us an email at info@Evexia Diagnostics. Okay, well, I think they must be wowed with your presentation, Dr. S. So before we conclude, I'd like to just take a minute to highlight a few Evexia nutraceutical products that correspond directly to the topic and information that you just covered. So the first one that you see here is the essential CoQ10. CoQ10 is one of the most vital antioxidants and is typically recognized for its role in energy production. Individuals who may benefit from CoQ10 supplementation include the elderly, as well as those with dyslipidemia, liver disease, mitochondrial disorders, heart conditions, genetic CoQ10 deficiencies, or those with exercise intolerance. The next one that we'll look at is Cardio Plus, and that is a powerful combination of substances designed to provide nutritional support for cardiac and vascular health. Now, maintaining strong vessel walls and healthy lipid levels are foundational for maintaining a healthy heart and cardiovascular system. And next is the homocysteine plus. Homocysteine is a natural amino acid made by the body during the metabolism of the essential amino acid methionine. The amount of homocysteine is in the blood a great indicator of overall health, and the goal is to maintain a level within the normal ranges as determined by a healthcare provider. Next up is the phytosterol plus, and that contains a combination of plant sterols and stanols that are effective in supporting healthy cholesterol levels in the body. And last, we've got the Pro-T enzymes, and that is a blend of two very potent proteolytic enzymes. These enzymes have been used for joint, cardiovascular, respiratory, and immune support, as well as helping the body establish a normal inflammatory response. Now, finally, I'd like to just briefly review how you can order the Evexia cardiovascular panels that Dr. S had covered for your patients. Step one, first you would log into your Evexia Diagnostics account and click on the Evexia link lab orders option. Step two, next you would locate your patient or add a new patient. Step three, you would then click on the Add New Order button to gain access to the test menu and select whichever cardiovascular panel would best suit your patient's needs. And step four, finally, you would review and confirm your order once it had been added to your cart and simply place your order. Now, of course, you can always reach us during our extended business hours from 8 a.m. to 8 p.m. Eastern Time, Monday through Friday at 888-852-2723, or anytime via email at info@evexiadiagnostics.com. We would love to hear from you and are always happy to assist with any needs or questions that you may have. Thank you again for joining us. Until next time, we wish you all the best on your pathway to wellness.